Indo eonkene mine atuboni. Indo eonyara mine atuboni. Tumo ire amo ide mazuje. Da semi vavali yo ide mazuje. Indo eonyara mine atubono. Indo eonyara mine atuboni. Indo eonyara mine atuboni. Tumo ire amo ide mazuje.
Some of our patients are very, very poor, and to find just 200 naira or 300 naira to transport themselves to the center and collect their drugs, they cannot afford it. That's talking about the antiretroviral drugs. Those are the drugs that are free. Antibiotics, antidiarrheal, multivitamins, antioxidants, they have to pay for them. NASCAP does not supply those drugs, even though they said in quotes, drugs for opportunistic infections, that they have them. I don't know how many times we have received these other drugs. And a patient that is having diarrhea, a patient that is having pneumonia, a patient that is, secondary infection, he has very good. That is why I said that we should belong to PEFA, and I'm making a case for the hospital and for the federal medical centers. Our PEFA should please come and help us, because our patients need these supportive drugs and these antibiotics, drugs for opportunistic infections. We cannot even make the diagnosis of some opportunistic infection because we don't even have the reagents. Cryptosporidiosis, Cryptococcus neoformans, and other toxoplasmosis. We don't have reagents to make the diagnosis. And we are a tertiary health institution. So how can you treat a patient empirically and for a tertiary health center for how long? What it means that if the patient recovers, then diagnosis is right. If the patient does not recover, the diagnosis is wrong.
The problem we have now is nutrition. Most of them, they don't have any support. Some of them, the family members have abandoned them. Some, they don't have any job doing. You know that one with this ailment needs good nutrition. So some find it difficult even to eat in a day.
You cannot reach them with motorcycle. You have to stop and then trek down the hill to such a far place. But for those that are accessible by road, yes, if you have a program, you have a team, like you said, the vehicle and with staff, and then some of these patients will not even give you their correct addresses, because we've just done some contact tracking and you find out that there's no such address. That was initially when there wasn't much awareness. People were trying to hide their identity. So people around them will not know that they have this sickness and that. But all that is gradually reducing now.
Somehow, a lot of things are changing. Many youths are coming open now. Like initially, it was only me. I was the only female voice in this town talking about HIV. But right now, 3 people have come up. Though they have not come up as much as facing the camera, but at least they can address other persons living with HIV, talk to them, counsel them. Some of them will even pretend they are not HIV positive, but they will talk to other people living with HIV about positive living. They could even talk to those that are not yet tested. They will encourage them to get tested. So I see that as a very big achievement.
HIV is not written on the face. You can't just identify the person that has it by me looking at the person. You may think you are healthy, you are free. But when you are tested, you can now see that you are infected or affected. I still have that belief and I still encourage them. I still pass this message on to them that there is need to get tested early.
Beyond drug, beyond hospital medication, they need other supports, as in to help them get firm, to help them get to a level where they'll stop depending on other people to assist them. So that's my highest expectation, to see youths just walk into the hospital, collect the result, look at it, HIV is okay. What next? Treatments? Okay, give me my treatments. That's my highest expectation for youths in Abia State. And we cannot achieve all that except we have assistance from other people that feel less. Let's come in and establish these people. Establishing them doesn't mean dashing them money, because giving somebody fish is quite different from teaching him how to fish. So I think the best thing is to teach us how to fish and just leave us to go along with it. And life will be very normal again. Naturally, stigma will just die a natural death.
send me Baba, you, them as